Stand up.
Hi, I am Nurse Ashley. I am the elementary here at Pocahontas.
And I'm Ann Boyson, and I am the high school and middle school nurse.
And we are just going to talk to you as parents to how to evaluate your kid before coming to school with the possibility of having COVID or what symptoms to look out for with COVID-19. So this is just a little chart we're going to talk about and then give you kind of some pointers to go off of.
We're also telling students at the high school and middle school, we're telling them the information that we're going to be giving you too. So what we are evaluating and what we would like you to evaluate your students or children is any high-risk symptoms. High-risk symptoms include a new cough, shortness of breath or difficulty breathing, and new loss of taste or smell. I realize that there's some people out there that have seasonal allergies and asthma. So if they normally have a cough or things like that, this is talking about a new cough that's not the same.
Or if they normally don't have allergies and now all of a sudden they're having, runny nose. If your child has 2 or more of these symptoms, Ann and I will be giving you guys a call, and you will have to come pick up your child, and your child will not be able to return to school until they've been evaluated by your healthcare provider.
And so the low risk symptoms, I guess I forgot to mention, are here also, and that includes fever, headache, muscle and body aches, fatigue, sore throat, runny nose, congestion, nausea, vomiting, and diarrhea.
We also understand too that some medications that your children or child may take may have some side effects of a runny nose, of a diarrhea or a stomach ache or vomiting or anything like that. So if your child does get sent home and they're going to be evaluated by a healthcare provider, your healthcare provider will then decide if they need to have a COVID test done or not. If they do have a COVID test done and their test is negative, they may return to school 24 hours with no fever, no fever for 24 hours without any fever reducing medicine, as in like Tylenol, ibuprofen, or like Motrin. And their symptoms are improved. If they're still not feeling good, they're still really tired, just keep them home. If they're not feeling well, they're not going to be learning really anything at school at all. Or if there's alternative diagnosis, so if they do to get diagnosed with something, but it's not COVID. So if it's influenza A, influenza B, a sinus infection, ear infection, anything like that, strep throat, that would be your alternative. If they are tested positive with COVID, they may return to school after 24 hours with no fever and without any fever reducing medication, and their symptoms are improving, and it's been 10 days since the symptoms first started. So if you get on day 10 and they still have symptoms, they still can't come back to school. If you're on day 11, 12 and they still have a fever, you still need to go that 24 hours before they can come back to school. And then once all that's done, then we would like for you guys to provide a note saying that they've been tested or not tested. And then please excuse, like just kind of like a doctor note that excuses them. So then we can give them an excuse and know that they have been seen by your provider.
We're going to be working very close with the Pocahontas County Health Department and the Pocahontas hospitals and clinics, Unity Point. So if they, let's say, find a positive COVID test in a student, they will let us know who that is, so we can work together to contact trace, find out where that student was when they had those symptoms or right before they tested positive for COVID, and we kind of go from there. The school, we are not allowed, nor will we give out any names of students who have COVID-19 or who may test positive for COVID-19 because of the HIPAA law.
And also things are changing daily, and so we will update you when we get the information updated. We also won't be screening your children. That's why we are giving you this video, so you know how to screen your kids. We're not temping your kids when they come, and then we ask that they wear a mask when they come to school. It's not required, but it is highly recommended, just so we can keep this safe environment for your children while they're here at school.
And we can stay open.
Right. And then also, if your child is 6 feet distance and they're socially distanced, they won't be required, or they won't have to wear a mask. But there is plenty of times during the school day that your masks will come off while they're eating, while they're at recess, while they're at PE, anytime they're allowed to be spread out. And as always, if you have any questions, you can give Ann or I a call or shoot us an email.